My name is Grace Price. I'm a family medicine physician and a leadership and preventive medicine fellow. And I'll be talking with you today about making space for wellness in your busy lives. So the objectives for today, first of all, to acknowledge how difficult it can be to make wellness changes in an already overwhelming schedule. Secondly, to give you some skills to implement small but meaningful wellness interventions in your life right now. And thirdly, give you access to learn more about the skills and approaches that we discussed today. So first of all, acknowledging the barriers. Many of you watching today have busy and even overwhelming schedules, and that can make it hard to implement new changes. It can feel like just adding another item to your to-do list. Healthcare workers also frequently put themselves last. And that has become especially true during the pandemic when we have so much compelling need from others that we need to address around us. And burnout and fatigue can make it hard, can reduce your own perceived ability to make a change. But to offset all of that, it's important to recognize the benefits of personal wellness and of some of the specific evidence-based approaches that I'm going to suggest to you today. In the talk today, we're going to cover mindfulness, exercise, and sleep. And there's evidence for each of those that they can improve mental health, including depression and burnout, that they can improve your energy and your focus, and then healthcare professionals can improve job satisfaction. And that also they can improve your physical health, including your inflammation, your cardiovascular disease, chronic pain, even all-cause mortality. So to start with exercise, there's some good systemic reviews that demonstrate a dose-response relationship between how much exercise you do and how much benefit it has for your major health outcomes. The biggest benefits come from adding any movement at all to an otherwise sedentary day. So even though many international guidelines recommend a minimum of 150 minutes of exercise a week, there actually is no minimum threshold for where you start to see health benefits from adding exercise. What this can look like for you in your day-to-day life would be something like parking farther away, so you have a bit of a walk in the morning, doing yoga or stretching for 20 minutes when you get home, or doing a 7-minute exercise video that the New York Times put out. It could mean taking a walk around the campus with your friend during your work shift, or a walk around the block when you get home with a friend or family member. And the World Gym offers a free membership to all Maine Medical Center residents and fellows, so you can make that part of your routine as well. In terms of mindfulness, there's excellent evidence that even very brief mindfulness interventions can reduce depression and improve quality of life in healthcare professionals. So one place to start would be with a brief mindfulness check-in. And what that would look like is finding a quiet place to sit during your day, starting by taking a deep breath where you feel the air coming in and out, and continuing to take those deep breaths and noticing how your body feels, perhaps repeating a word or phrase with each breath, and doing that for 60 seconds. And then going back to your day and seeing what from that carries with you through the rest of your day. There are also a number of free meditation apps that you can use to get started. One I use is called Insight Timer, and there's resources at the end about that. You could try walking meditation, which is a great way to improve exercise and mindfulness together. And the WOW group offers drop-in mindfulness and meditation groups for all Maine Medical Center employees. For sleep, it can be a difficult topic to hear about when you're in the midst of a crazy residency schedule, or you're working shift work, or you're a new parent. That was when I had the most trouble with sleep, is when I had no control over my schedule because of a newborn. But even in those times when you have no control over your sleep schedule, you can still control some of the quality of sleep that you're getting. And so that can mean avoiding all screens and work for at least an hour before bed, doing a brief mindfulness exercise right before you go to sleep, avoiding alcohol, and just keeping active and eating well throughout the day, all can really improve the quality of your sleep, even when you can't control when you're getting your sleep. So I hope that some of these suggestions are helpful to you in finding your own pathway to wellness. There's a lot more information and resources available in the following slides. Thank you all.